Magandang araw, Yilakanja. Hello, Dr. Elton.
Hello, Ate Blandy, at hello sa lahat ng sumusubaybay ng ating show na Cure. Sayang, no? Tayong dalawa lang ngayon.
Oo, wala siya.
Balita ko nag-aalaga siya ng baby. Anyways.
Papa chores.
Oo nga, may Papa Chores daw si Dr. Rivas. Kaya kaming dalawa muna ngayon. So, bago natin simulan ng topic ngayon, allow me to introduce our guest doctor. She's an endocrinologist. Yung endocrinologist ay isang doktor na tumitingin ng mga sakit katulad ng diabetes, goiter, at mga hormonal imbalance. And she holds her clinic at the St. James Hospital from Thursdays up to Saturdays. Tuwing Monday to Wednesday, nasa Quezon City siya. So, medyo masipag talaga si doktora. So, please welcome the beautiful Doktora Eva Pipo.
Okay, thank you, Dr. Elton, for that introduction. Parang ang lapit naman ng Quezon City at saka vegan. But that's true. I hold clinic as far as Quezon City.
Medyo naglalagari talaga si Manang. Napakasipag niya, no? Oo, na-tense naman ako. Kasama ko puro dalawang naggagandahang manang ko.
Para sa mga viewers natin, ang pag-uusapan natin ay isang sakit na diabetes, which is one of the top 10 leading causes of death in the Philippines. Dr. Eva, ano po ba ang diabetes?
Okay. Diabetes, or ang complete name is diabetes mellitus. So parang brief lang. So ang diabetes, the word diabetes was coined from Greek word which means paglabas ng tubig. Yung mellitus is from Latin word which means honey. So in short, it is a sweet urine. No? Okay, so ano nga ba po ang diabetes mellitus? So ito ay chronic disease or pangmatagalang sakit, and it is a metabolic, tinatawag na metabolic disorder due to defects or disturbances sa carbohydrates, proteins, and fat metabolism due to the defects in the insulin action or insulin secretion, or it can be both. And ito ay pangmatagalan at resulting to hyperglycemia or pagtaas ng blood sugar. Medyo mahaba.
Manang, nabanggit mo yung term na insulin eh. Para sa kaalaman ng mga manonood natin, so ano ba yung insulin?
Okay, ang insulin ay isang hormone na galing sa pancreas, yung tinatawag na beta cells of the pancreas, that would help regulate yung action of glucose. So yung glucose, or what call as yung blood sugars, we need glucose in our body. Almost all of our cells need glucose for energy. So para ma-use up natin itong glucose, we need the hormone insulin. So kung briefly, parang i-compare natin yung insulin, it's like a key, and then, or susi. Yung glucose, parang gasolina. So yung sasakyan, yun yung tao. So we need glucose, o yung sasakyan, kailangan niya ng gasolina. So para ma-use up itong gasolina, kailangan natin, or para umandar din yung sasakyan, kailangan natin ng susi. And this is the role of insulin, para ma-use up natin itong glucose or blood sugar. Otherwise, it would just pile up itong glucose, resulting to yung tinatawag nating hyperglycemia.
Okay, so kung walang susi or insulin, hindi magagamit ng makina or katawan yung glucose. Kaya nandyan lang siya sa katawan natin.
Yes.
So ano-ano bang mga dahilan or mga causes ng diabetes, Manang?
Okay. Maraming causes. We call it multifactorial. So it can be hereditary, or it can be genetics, or it can be environmental. So yung environmental, dito papasok yung diet, and also yung type of activity or sedentary lifestyle. So, hindi lang isang cause, it's a multifactorial problem in causing diabetes.
Namamana pa siya, no?
Oo.
Yes.
So, ano yung mga iba-ibang types ng diabetes?
So, dati, years ago, or traditionally, naririnig natin yung juvenile onset at saka yung adult onset. So juvenile onset kasi mas common yun sa bata, and then adult onset yung pagmatanda. So they base the classification according to the patient's age at the onset of symptoms. Kaya lang, this has been revised. So, ginawa nilang yung tinatawag na insulin dependent, yung IDDM, or non-insulin dependent, or NIDDM. Kaya lang na naman, ang daming mga committees or mga associations worldwide na hindi daw ito bagay or it's not satisfactory. Kasi yung classification na yun was based on the treatment or therapeutic classification. So in 1999, yung American Diabetes Association at saka yung World Health Organization have formed a new classification for diabetes, and this is based on the etiology or the cause. So ito yung type 1. So yung type 1, it means that there is an absolute insulin deficiency. So ibig sabihin, wala siyang insulin production from the beta cells or naubos yung insulin production. And this is common among kids. Kaya nung araw tinatawag nilang juvenile. And then they also need insulin for life. So kailangan nila yung insulin for the rest of their lives. And then yung tinatawag namang type 2 diabetes. So ito, ang cause, it is relative. So ibig sabihin, meron pa. So it's a relative insulin deficiency. Pwede rin, meron pa rin siyang insulin. Kaya lang, hindi na used up yung insulin because of yung tinatawag nating insulin resistance, or it can be both. So itong type 2 is the more common type of diabetes, and it is the more prevalent form. It is more common among adults. Although lately, in the recent years, may mga type 2 na kids as early as 10 years old because of obesity. Yung another type is yung tinatawag natin gestational diabetes mellitus. Ito, nalaman na tumaas ang blood sugar, or we call it as carbohydrate intolerance, which is noted first during pregnancy. And then, another type, ito yung hindi ganun ka-common. Yung other specific types, so yung mga genetic defects in the beta cells. It can also be yung tinatawag naming secondary diabetes. So it is chemical-induced or drug-induced. And there are also other diseases in the pancreas that can lead to diabetes. Ito pag nagkaroon ng pancreatitis, or yung almost 2/3 of their pancreas have been removed, or meron ring mga ibang sakit din that can also lead to elevation of the blood sugar. So eto na ngayon yung ginagamit. We use the Arabic instead of the Roman numeral. Diba? If you can remember, yung type 1 nila as in 1. So ngayon, pag classify, sinusulat is type 1, DM. And then type 2 as in number 2, DM. And then GDM, or secondary diabetes.
So in short, parang pinadali na nila. So type 1, type 2, gestational during pregnancy, and then yung mga other specific causes.
Yes, they classified it according to the cause or according to the etiology. No, ano nga ba yung nagko-cause ng diabetes na ito? And I think it's more appropriate kasi through the years, nalaman na marami palang causes of diabetes.
No, pero so yung type 2, yan na yung non-insulin dependent dati. At saka siya yung adult onset.
Yes,
na
yung type 2, ito yung more common in the adults. So yung iba kasi dati ang tawag nila non-insulin dependent. Pero pwede din naman kasi ang type 2 mag-insulin. So pwede sila kahit oral medication or insulin. So, pwede rin sa type 2 ito.
So, ano yung mga signs and symptoms ng isang taong may diabetes, doktora?
Okay. So, yung classic signs and symptoms, and eto yung familiar tayo. So, yung tinatawag na polyuria or madalas na pag-ihi, especially at night. Yung iba ay, since madalas ihi ng ihi, so nauuhaw, or we call it polydipsia, or excessive ang thirst. This is yung nauuhaw sila or parating nasa CR or umiihi. Ito ay common in kids. Yung iba naman ay kain ng kain, or we call it polyphagia. But despite that, they are decreasing weight or nagkakaroon pa rin ng weight loss. Yung iba naman, especially sa adults, sasabihin nila malabo ang paningin, o kaya merong nararamdaman sa mga kamay or paa. So parang may gumagapang o kaya numb. Yung iba naman, walang sintomas. And it was only noted kapag nagpa-screen, especially for employment, o kaya yung iba ay nagkaroon na ng problema. And dun lang nalaman accidentally.
Okay, so pero totoo ba yung nagkakaroon ng langgam daw? Madalas na nilalanggam yung ihi ng may diabetes?
Yes. Actually, no, Ading, yan yung logo dati ng Diabetes Philippines. Buti pa ang langgam, alam. Kasi yung iba, napapansin lang nila na ang kanilang urine ay nilalanggam. O kaya yung mga damit. Kasi nga, dati di ba sabi nila, diabetes mellitus is sweet urine. So, kapag mataas kasi ang blood sugar natin, we spill this glucose in the urine.
O ayan, sobrang liwanag na ng pagkaka-explain ni Manang tungkol sa diabetes. Mamaya, mas marami pa tayong malalaman tungkol sa sakit na ito. Kaya dyan lang kayo at magbabalik ang Cure.
Cure.